Sorry, I was muted, so let's start that over. We're learning our technical abilities here. Thank you,
Okay, so we're all
Claire.
set now?
So we're all set, we're on air. I am opening it up to questions based on what we heard from the secretary or anything.
Yeah,
Go for it.
it's not a question,
Okay.
it's a statement.
Great.
That was a wonderful presentation, about the Agency of Human Services, but the facts are, there are people out in our communities that are in dire need of services. And because of staff positions not being filled, decisions aren't being made. We all know about what's going on in mental health, people lying around in emergency rooms that need care. So we've got a big job to do. And I hope we all can stick together and make sure that, we're going to talk about this later this afternoon too, that when we do things, we don't end up with unintended consequences that hurt somebody. We've got a big job here, and I'm looking forward to doing it.
Thank you. We do have a big job, and thank you for the reminder. And I think Representative Wood said it well too. It's from our youngest children to our oldest Vermonters. Everyone, every age group is struggling. Representative Cordes.
On that message, I'm curious, and not that we need to answer it now. I need to dig in more to the governor's recommendations in the BEA, but the one phrase struck me, and the proposals that the administration is making, part of how they are going to be paid for is by Medicaid savings. And what does that mean?
Okay.
I immediately thought of this.
Redetermination.
Yeah, no, that's a good point. And I'm going to come back to the BAA real quick because I think that brings up a couple things we should talk about. But anyone have any other statements or questions?
I do, and I think it's especially when we talk about mental health and the work that we have ahead of us. I think just keep in the back of your mind that treatment does work. And yes, there are significant barriers to accessing care, but treatment does work for people. And so I think just remember to keep that hope that we can help people get there, and we can get there ourselves. And I think that's important to remember, that there are things that work, and they're out there, and they're here in Vermont.
Thank you. Representative Coleman.
So I just want to make that connection between the 3.7 billion, and we know that budgets are a statement of philosophy, and that all that money is going to these people, and that we should not just think about dollars. We should think about what the dollars are doing. And sometimes I think we spend a lot of time on that number, and I think we need to see beyond it.
Good point. Thank you.
I just wanted to thank Representative McFawn for what he said, because it is people in our community who can't get health care. It's also people sitting here on this committee who can't get health care. I go to a community health center for my primary care. My doctor left a year and a half ago. They don't have a new one yet. And they've been having various sort of temporary doctors cycling through. So what you said hit very much home with me, and I 100% agree with you. So thank you.
We have our work cut out for us, that's for sure. So on the Budget Adjustment Act, we talked about it a little bit. So it is being presented this week through an appropriation. So if you look on the appropriations website, you'll see when they have the various departments coming in to talk about it. It's always good to watch it on YouTube. In the evening you can, forward it or do the 1.5 times or whatever, but it's good basis. We will have those departments that we have jurisdiction over in also to talk about the BAA adjustments. And so again, the BAA is basically so it's based on the fiscal year that we're in. It's a half-year adjustment to see what we need to do. It's all that the governors recommend. And then we have the opportunity to come forward and say yes or no, or add or delete or whatever the case may be. So it starts in the House. We pass it out of the House. We send it to the Senate. And then it goes through the process over there again. So I have asked, and we've done this before in this committee, the ranking member, so Representative Black, to be the point person on all budget issues. So she'll follow it. And I've asked Representative Rebecca to join her in that effort. They'll make sure we know what's going on, but there will be no decisions made by them alone. It will always be a joint committee collaboration going forward. So we'll probably start the BAA work, late next week. But again, the documents and being able to watch the House Appropriations committee hearings are always open to everyone. So if any have questions on any of that, we can talk offline. Great.
They're taking testimony today, actually, from
DMH and
DMH and Department of Health.
Right.
And then tomorrow is
Diva.
DEVA.
And Dale, I second.
So let's take a break until 9:45. If you can come back a couple of minutes early, and let's get started right at 9:45. And we will have Nolan and Amarin from Nolan from JFO and Amarin from Legislative Council in to go through the history of healthcare reform in Vermont.